euros and a 12-month limit on stays for unskilled workers. One UK institution that relies heavily on migrant workers is the country's National Health Service. Chief Executive of NHS Employers, Mortimer, told me how the government's plans for post-Brexit immigration will affect the service.
So across the country, we see about 7% of the NHS's 1.4 million workers drawn from within the EU. Those percentages are concentrated particularly in London and the South East. So there are institutions in London, for example, where 20 or 25% of the workers in that institution will be overseas nationals.
And what kind of reassurances have the NHS been able to give to those workers with Brexit looming?
So the government is putting in place a settled status scheme for EU nationals. It's actually launched that scheme in advance of the rest of the economy in health and social care, and that's a really welcome, really positive step in terms of the government absolutely saying to those workers that they're an essential part of our team. What we want to see, of course, is a migration system then after we leave the European Union or after the transition period ends, which allows us to continue to recruit new colleagues to join those teams, and we will need that for some considerable time after the transition period ends. The government have made a significant investment in healthcare. We hope for additional investment to come in the next year or two in social care as well, and actually most of that investment is in people. It's in extra staff to provide extra and better services for our population, and again, for some years we will need to supplement our UK workforce with talented individuals from around Europe and the world.
The UK government's planning to phase in these rules from 2021. Does that give the NHS enough time to adapt and prepare for these changes?
So I think it's fair to say that the NHS has been looking to increase the number of staff that it trains domestically. There's been, in particular, the government have made a significant expansion of medical school places. But it takes 5 years for a doctor to go through medical school and probably another 10 years for them to be ready to be a consultant or a general practitioner. It takes us 3 to 5 years to train a nurse. So whilst those plans are being stepped up, the lead-in time is significant. And what we will see in the new year in England is a plan that will expand and improve many of our services. And again, that will undoubtedly generate further requirements for new staff, and there are lead-in periods which will stretch well past 2021 in terms of bringing extra people into the workforce.
Mortimer there, Chief Executive of NHS Employers. Well, still to come here on Euronews tonight. After months of clashes with the EU, Italy has finally agreed a deal